Good morning. I think we are going. I am seeing a lot of attendees joining us, so we'll just give it a minute here to let people log on. Good morning, welcome. We're just letting folks log on. We have more than 500 people who registered to be with us today, so may take a minute or two for everyone to get plugged in here.
Just a reminder to everybody to mute your lines until you're ready to start talking for the panelists. And for all the attendees, we'll keep you muted.
Okay, people are still joining, but I already see the most common questions that we have coming up. So we'll get to those right as we start. I'm going to just give it another minute. I see we've got about almost 400 folks logged on. We're expecting closer to 500. So stand by to begin. Everyone is coming in muted with no video. And we're going to keep you that way, not because we don't like you, but because we're really testing the bounds of technology today. Okay, everyone. We still have folks joining, but we have a lot that we want to pack into this session today. So we're going to go ahead and get started. Good morning. My name is Jace Woodrum. I'm a senior officer on the policy team at the Colorado Health Foundation. Thank you for joining us for this webinar briefing today. I know how exceptionally busy everyone is during this really chaotic time. So I'm grateful that you signed on today for this conversation. If you are anything like me, you're feeling majorly overwhelmed at all of the policy changes that are happening essentially every minute. In fact, a new policy could be enacted while we are talking for the next hour. So hope that you can roll with the punches with us, and hopefully we can clarify some of what's going on. We're going to be talking about the government responses to COVID at the federal, state, and local levels. We'll also touch on at the very end the philanthropic response. So a lot that we want to cover today. We are going to keep things big picture. There's so much going on, so many different kinds of folks on today that we could never cover everything that everyone is interested in, but we will do our best with giving a high-level overview. We have more than 500 people on. You are all muted, and we've blocked your video to ensure the best quality webinar possible. Given that this will be less of a back and forth conversation than anyone wants to have, but hopefully we'll all learn something, and we'll try to answer at least some of your questions in the time we have together. I just want to go ahead and say that we won't get to all of your questions in this one webinar, but please think of this as a first conversation and not a last. We're going to be doing Q&A at the end of the webinar today, so we can get through all of our content. Please put all of your questions into the chat box. If we don't get to them today, we still want to know what they are. We're planning to provide additional resources after this webinar, so please don't censor yourself. Ask away all the questions that have been keeping you up at night. Please put them in the chat box. We'll cover some of them at the end of our conversation, and then we'll try to figure out how to answer others in the future. I know this has already been asked because some of you are well prepared when you come to webinars. We're all getting pretty good at this. We are recording this webinar. We will make the recording available after the fact. We will also share the slides. We will have other resources in a follow-up email, so we've got you covered there. I think I'm ready to move on to the meat of the day. Panelists, get ready. I have two super smart people with me, Kyle Rojas Legleiter, he's our Senior Policy Director at the Colorado Health Foundation, and Dawn Joyce, who's a Vice President with the Wynne Health Group. We are going to start with Dawn and the federal landscape. Dawn, thank you for being here with us. I've been reading the news. I've been getting completely stressed out every time I do. But when I've been reading, I feel like I've heard about 3 big legislative packages. Is that right? And Danny, I'm going to let you know to please go ahead and advance the slide. And Dawn, take us away here.
Great. Good morning, everyone. Thank you very much, Jace. Yes, indeed, that is correct. Thus far, we have 3 packages at the federal level that we'll be going through and answering questions from Jace about briefly today. There are, Jace, shall I delve into them now?
Yeah, let's, next slide, Danny, we'll do the top 3 and then go through each package. Oh, back one, Danny.
Great. So there, as indicated on your slide here, and again, the slides will go out to you via email, so you'll have these as well as a significant number of background documents that get into detail. There are 3 legislative packages, 2 of which have passed, one of which the text was released about last night. So as Jay said, all of this is very much fluid. Next slide, please. The first package, by and large, what it focuses on is funding. It's a supplemental package. It focuses specifically on funding for the federal, state, and global response. This includes nearly half of the funding is specifically allocated for research and development, and also purchasing once it's available related to vaccines, with respect to COVID vaccines, therapeutics, so medications that you can treat it with once those are available, and diagnostics. It's also, that large portion of funding is also designated specifically for stockpiling those things to make them available for the nation. About a quarter of the funding is specifically designated for public health funding. This includes, when it actually gets to Colorado, about $9.3 million that of the funding that's been allocated so far, that's what's designated for our state specifically for public health emergency preparedness. There is a little bit of funding in it for community health centers. There's a lot more funding potentially in what's pending right now in our 3rd package for community health centers, which is essential, of course. There is also, apart from the funding in that first package, the piece that it also included was significant flexibilities to expand telehealth specifically for Medicare. We know, of course, that this is needed across all populations, as given that initial data indicated it was most dangerous to the older population. This was included in the first package. So and since guidance has been released that specifically expands how much telehealth can be utilized as much as possible for our Medicare population. Next slide, please.
And Dawn, I'll just sort of put a bow on this to say, like, it felt like the first thing that Congress did was like try to fight the virus itself, right? This risk of exposure, vaccine development, telehealth. Is that kind of a good wrap up of what that first package was really meant to do?
Yes, exactly. Basically to try to strengthen our public health system that's otherwise been woefully underfunded for decades. Great news, since it's a hard time to ever share great news, as folks likely saw earlier this week, there are indeed vaccine trials underway in Washington state that's building off of science that was already in process and fortunately complementary to what's happening. So yeah, that's a great wrap up of that first package. Thank you, Jace.
Sure. So high level, what is the second package all about?
So the second package is all about protecting consumers. So this is it extends no cost sharing for all COVID-19 diagnostic testing. We previously had seen high cost sharing associated with that initially. It also creates state options to expand that testing and allow it to be funded and paid for when provided to the uninsured at 100% on the federal dime, which is great, but you have to take state action to be able to do that. Additionally, recognizing that there's lots going on with the economy, potentially increases in Medicaid, et cetera, it includes a significant 6.2% increase in federal funding for Medicaid. So the portion of our program, of our Medicaid program that will be paid for by the federal government. That will certainly be helpful. As lots of folks have heard about, it does indeed include provisions related to emergency family and medical leave, as well as paid sick leave. That's something that in the questions, we're happy to answer questions about and get into those details. There's also details included in the materials that folks will be receiving. What's important to note there is that almost all of the provisions in that and in the bill that's pending that the text was released about last night, all of those apply to companies with 500 or fewer employees. There also are currently some exemptions in the third package related to this for federal employees. It gives GAL the chance to exempt them. So we'll have to see what happens there. It also expands the kind of protective gear. We've all heard about the severe shortages in that. It expands that and offers liability coverage for kinds of masks, et cetera, that aren't ideal, but are better than nothing to utilize so that companies providing those aren't liable if things were to go wrong. And then important from a public health perspective, things around data sharing, because we can't get a hold of this if we don't actually understand what's going on. And last, and we're happy to answer questions about this down during the question section, particularly with my colleague Taylor Cowie, who's on the line, is it does a lot to create additional flexibilities and additional access to nutrition, which of course is essential at this time.
Thank you, Dawn. So, okay, so this is really about like protecting Americans who are impacted, and we know that number is really, really increasing every day. Okay, so we said there were 3 packages. What is the third one all about?
So
the next slide, Danny.
Great, thank you. The third one is an enormous stimulus package. We'll also include more information about this when we send out the information. So this would be, again, the text of it was just released last night. This is McConnell's version of it. There is a Democratic version of it. We're likely to hopefully see a vote on this next week. I'd like to just highlight a few really high level things. So it would be the largest and most extensive and expensive stimulus package in American history. It does include individual payments that folks have heard about. Those do have parameters placed on them in this version based on income and family size, capping out at family incomes of $99,000 and above wouldn't receive pieces of it, which is different than initially thinking they would give it to all Americans. They are indeed focusing hopefully on where the need is the greatest. It also includes significant loans for businesses and corporations that are hit the hardest, at least thus far, in terms of the economy, things like our airlines. It includes significant pieces with respect to small business loans. We all know that those pieces are struggling enormously and are the backbone of our economy. It does delay our tax filings from April 15th until July 15th and waives certain things like people that need it can pull money out of their retirement if it's coronavirus related and they don't pay fines based on that as they usually would. And then there also are pieces around educational loans, both in terms of, it gives the secretary the option to like basically pause those. It's not that that has happened yet. It also lets students who we know are leaving, have all had to leave their universities to utilize and maintain their Pell Grants, as many may need to do literally to have a place to live. So it's this enormous stimulus for the economy, but trying to target specifically the areas that are needed. And it does outline a lot more detail around the paid sick and family leave.
It's really remarkable to me that it looks like 3 packages of legislation will pass Congress when legislation passing through Congress seems like such a rare thing, but it really seems to be happening in record time. And it's really not just Congress. I feel like my phone has been buzzing nonstop with New York Times alerts about like this agency doing X and another agency doing Y. And I know we can't cover everything that all of the agencies are doing, but can you tell us a little bit about some of the biggest things that federal agencies have done? And next slide, Danny.
Great, thank you. So there are various pieces with that. We have an announcement. We don't have the actual guidance related to this yet around housing. There are a few things that folks have likely seen in the media. So there was mention in a White House briefing that they're planning to pause any and all foreclosure and evictions, at least through the end of April. There's also reports of this bill it's about 300 pages last night, so hence why we've read as much as we can, but it's a lot to master in a short amount of time. So that it does look like there are protections for mortgages there where those pieces could be delayed. Additionally, there's all kinds of things. There's pieces that just happen to try to drastically expand access to hand sanitizer, which we all know is very difficult to access at the moment. There's other pieces to allow, for example, they're trying to pull all of the masks that are otherwise used in construction companies and make those available to hospitals, things like this. The last thing that I do want to mention with respect to that, this is not a federal agency, but it's the executive branch, but the White House has both declared a state of emergency, as folks know, and that creates flexibilities for us. Additionally, under the Defense Production Act, that has been like partially evoked, but not fully activated, if you will. It's a bit complicated. That has the potential to reportedly make up to 5 million N95 respirator masks available, which of course are very much needed. And essentially, this is a wartime measure that would allow the executive branch to call on industry in our country to direct its resources towards making what we actually need to address the pandemic. And of the materials that will be sent out, it has a full summary of all of the guidance that has been implemented as of yesterday morning.
Thank you, Dawn. And yeah, another reminder of how quickly this is changing minute by minute, and we'll send out the slides and more information, but that information could be out of date, the second we hit send, because everything is really just moving so fast. And if you're feeling like that was a ton of information to take in from Dawn, you are not alone. If you are feeling like you just took a ride on one hell of an emotional roller coaster, know that I am screaming with my hands up right beside you. These are challenging times for all of us, and especially for those of you who are serving the most vulnerable among us. So if you feel like you need to press escape and get out of this webinar to go on a run or grab a stiff drink, I will understand. I hope you'll stick with us, though. I've been seeing a lot of questions coming in through the chat box, so please keep that up. We'll try to get to some at the end. And then we'll have to, I'm sure, have many other webinars or other ways of sharing resources with you. And speaking of that, we have a question for you to that end. Danny, if you would please launch our first poll question. We want to know from you, what kinds of resources would be most helpful to you during this time? Are webinars like this on additional topics most helpful? Are you more of a reader? Do you want blog posts and emails with information and resources? Would you like opportunities to connect virtually with other nonprofits who are wrestling with some of the same questions and challenges? Or are you hungry for a discussion with policymakers? Let us know what resources are most helpful to you during this time. As you are answering that question, we're going to shift our focus to the state level and bring Kyle into this conversation. Dawn's going to hang with us for questions later. Kyle, we could talk about any number of things that the governor's office is doing. So I'd like us to start with a big one. On March 10th, Governor Polis declared a state of emergency. What does that mean? What does it do? What has it done? Talk to us a little bit about that.
Great. First, Jace, can you give me the all clear that you can hear me and I'm not still on mute?
All clear. I can hear you.
Great. Good morning, everybody. So as Jace mentioned, the governor did declare a statewide state of emergency on March 10th. And I the way that I've synthesized what that means is it does a few things that are sort of unlocked with that emergency declaration. One is sort of additional authority for the governor and state agencies to do things in very short order that they otherwise would not be able to do. It gives the administration a lot more flexibility about how they do business and how quickly they could do business, and the ability to tap into some resources that they otherwise would not have access to without the state legislature acting. So I'll give you a few examples of what each of those have looked like since that emergency declaration on March 10th. So in the vein of additional authority of things that the governor ordinarily wouldn't be able to do is the statewide closure of schools now across the state of Colorado. That's something that ordinarily school boards and local schools have the authority to do, but the emergency declaration gives the framework where the governor now has the legal authority to take actions like that. And a lot of the news that you've seen covered in the media has really focused on those kinds of interruptions, suspensions, modifications to how we go about doing business in our daily lives here in Colorado. The governor has set up a great website to sort of keep pace with and announce all of that stuff in real time that we will send a link out to everybody. And so that will be at your fingertips after this webinar. In the vein of additional flexibilities that are unlocked with this emergency declaration, that gives state agencies the ability to do emergency rule packages around things like paid sick time or healthcare workforce regulations that allow us to surge up the workforce and the types of people who can deliver healthcare services during this crisis moment in Colorado. On the resources front, the governor now has the ability to tap into some emergency funds. One of the things that they were immediately able to do was unlock this pool of $4 million within state government that didn't require action from the state legislature that they have now nimbly deployed to standing up some of the things like public communications and scaling up the medical response to the COVID-19 outbreak in Colorado. So that's another thing that the emergency declaration has unlocked. And one of the other and really significant things that it does is prioritizes and focuses the apparatus of state agencies in Colorado to focus specifically on COVID-19 related issues right now. And so in the resources you'll receive from the Wynne Health team that Don started alluding to, with additional flexibilities that federal agencies have unlocked for how programs like SNAP and WIC and school meals and Medicaid and Medicare are administered across the state of Colorado. A lot of those additional federal flexibilities require states to essentially opt into those flexibilities and to tell the federal government, here's what we need to do to adapt to the situation on the ground. And so you'll see state agencies like the Department of Healthcare Policy and Financing, which administers Medicaid and CHIP across the state of Colorado, the Department of Human Services, which administers lots of food assistance programs. This is their #1 focus right now. And a lot of those state agencies have set up dedicated COVID landing pages on their websites to keep the public and stakeholders like you informed in as real time as possible about the status of the kinds of waivers that they're requesting of the federal government and how they're responding to the additional flexibility that they now have in this moment.
Thanks, Kyle. So one of the things you mentioned is one of the things I've been following most closely because it impacts my life, like what's closing, ski slopes, schools, DMVs, gatherings of 10 people or more. But what I have not felt like I have a good grip on, and I'm going to guess that most of us don't have a great grip on it, is what's going on with testing. So can you tell us what the state has been doing to get people tested?
Yeah, so some of the immediate things that they've been doing are creating these like landing pages for folks to get real-time information about a rapidly evolving situation with testing for COVID right now. And we'll send out sort of the 2 top places that you could go for real-time information about testing available via the state government. It's the covid19.colorado.gov landing page for all things COVID. And then CDPHE, the Colorado Department of Public Health and Environment's COVID landing page is where you'll see the latest breaking news about that. But some of the stuff that's already being done across the state is expanding the number of places that testing is administered right now, as well as the kinds of health professionals that are cleared to conduct these kinds of tests. So for example, one of those emergency rule packages that the emergency declaration gave state government the flexibility to do was giving all EMTs across Colorado sort of a pass to do this kind of testing. And that's something that wasn't necessarily within their scope of practice before now, but they are taking steps to expand and increase as they are able to the number of places that people can go to for testing, as well as the number of people and the types of people who are cleared to administer and conduct and to collect these tests, and creating landing pages on the web for folks to go to get as current information as possible about how that rapidly changing picture is shaping up across the state.
So the impact to the economy has already been significant, and we're still really early days here. I mean, unemployment claims have skyrocketed and tourism has screeched to a halt and the stock market, it's bad. So what has the governor been doing to try to help address the negative economic impacts?
Yeah, so this is another major front of activity across levels of government. On the state front, there's been a number of things that speak and sort of address specifically towards individuals who've seen potentially their employment situation change overnight with a lot of the closures and other things that are just happening right now related to COVID-19. One of the best places that folks can go to for information about that is the Colorado Department of Labor and Employment's website and landing page. That's where you can find information about the unemployment claims process and how that is changing in Colorado. And you're right, we've seen a very rapid surge in unemployment claim filings across the state as stuff is getting shut down across different sectors in our economy, as well as information about a package of emergency sick time rules that the governor did shortly after that emergency declaration back on March 10th that expands who has access to that kind of stuff. And then there's a number of sort of business-facing measures that are being taken in Colorado that have been unlocked by the emergency declarations, both at the state and the federal level. And specifically, some small business loan opportunities are available through the Small Business Administration's Economic Injury Disaster Loan Program. They're now coming online to help small businesses who've seen an interruption or a suspension to their ability to do business, and that has effects both for the business itself and for the workers and the employees who've been employed by those small businesses. And there is a landing page to go to for information about that we'll share out the link to as well. It is choosecolorado.com.
So it's not just the governor when you think about the state level. And I know I've been reading, and probably most folks have seen that the state legislature just shut down mid-session. And that, of all the things that are happening, that is yet another thing that has made me quite nervous. So what is going on there? And if the legislature isn't in session, and of course it isn't, what will happen with the state budget, the one bill they absolutely have to pass?
Yeah, so this is another situation where I feel myself groping for synonyms of unprecedented or fluid situation and all that, but you are right. To sort of observe the social distancing recommendations and restrictions on gatherings of large groups of people, the legislature, just as an institution, is one of those institutions that's been affected by those recommendations. And so they did take the unprecedented step this week of suspending their operations mid-legislative session this week. And that has not been done before. And so the legislature did a flurry of sort of must take care of things shortly before they went on hiatus to prepare them to sort of go dark for a little bit of time. And we don't know yet exactly when the legislature is going to come back. That is a fluid situation. But they did want to, just as people and humans and the state capitol being a place that in ordinary times during session is a hub of activity, they did want to shut that down just to respect the social distancing recommendations from public health officials. And so we are in uncharted territory with the state legislature going dark halfway through its regular course of work in the legislative session that even in a normal year is really busy with a lot of activity. One of the things that the legislature had not yet gotten to before they went on hiatus was developing and passing the state budget for the next fiscal year. And that is another thing that is rapidly changing in response to the changing economic conditions because of COVID-19. And so whenever the legislature comes back to business, passing the state budget and coming up with a state budget for next year will likely be their top priority and main area of focus whenever they come back and get to conducting business again. But there was some breaking news earlier this week that impacts the state budget that was delivered to the legislature as they prepared to go dark. And that is an updated economic forecast for the state of Colorado. And this is something that happens on a regular schedule with the legislative process. And essentially, it's a way for the folks in the state legislature who are responsible for writing the state budget for Colorado to estimate how much money is available based on the tax revenues that we expect given the economic conditions in Colorado. So it helps them to determine and estimate how big of a pie they have to distribute. when we started the state legislative session back in January, the economic forecast that we had at that point in time estimated that we had ballpark about $800 million more to play with in the state budget for the next fiscal year than we had in the current fiscal year. The state economic forecast that the legislature got earlier this week essentially warned them that economic conditions are contracting rapidly, and that $800 million that they had started the session's work thinking that would be available is probably not going to happen. So their warning to the legislature was probably the most optimistic scenario for the state budget next year is that it will be flat with this current year's budget, which means no new money for anything new in next year's state budget, and no increases for existing programs and services, even if they're just increases to keep pace with inflation or population growth or more people needing services in light of changing economic conditions. And there was a fairly stark warning that that's probably the optimistic scenario. If the economic impact of COVID-19 continues to worsen, the legislature could find itself in a scenario where they actually have to cut from the existing budget when they're able to return to working on the state budget when they come back to business, whenever that may be. So the top line there to take away from that is the state budget picture is one of the top areas of focus for the legislature when they come back to work. And in the meantime, they're absorbing a lot of sobering news about what they will have to work with and the probably very tough decisions that they will need to make when they come back to session and focus on passing a budget for the next fiscal year.
Well, that was some sobering news on our end as well. We're always in a tough budget situation here in Colorado, and seems like this year, tough doesn't begin to describe it. We're seeing questions come in through the chat. Thank you. Some of them, keep your eye on the chat. Some of our panelists are answering in the chat itself. So keep an eye on that. I know that many of you want to dig in on specific areas like healthcare, hunger, housing. We won't get to that level of detail today, but we do want to create other opportunities. So keep those questions coming in. And Danny, can you bring up the second poll question? We'd like to know what topics you would most like to know more about as we move forward. So hunger and food assistance, housing, healthcare, early childhood and K-12 education, the economy and employment or unemployment issues, something else. You can't tell us what something else is through this technology, but I'd still like to know if there's something else that you're interested in, and we'll make our best guess, or we'll be able to find you all. All of these are not anonymous polls, I don't believe. So let us know what you are interested in knowing more about and digging in deeper on in the future. And we are going to shift our attention now to what local governments are doing. Kyle is going to continue to tell us about local governments. Have they shut down too?
The short answer is yes, many of them have, and a lot of them are taking action very quickly in response to COVID-19. But the good news for all of you on the webinar today is that thanks to a brain trust of partners that we have at the Colorado Health Foundation, with a local government firm, CRL Associates and PowerMap, we have stood up a great resource that will help you to keep track of all the different things that local governments like cities, counties, and local school districts across the state of Colorado are doing. It's a live tracker of emergency declarations, policy decisions, service modifications, and all that the local governments are doing. So in follow-up to this webinar, you will get a link to this live web page where you will be able to see in as real time as our partners are able, that changing picture of city governments, county governments, and school districts across the state of Colorado and what they're doing. So it's a lot of information that's changing really quickly, but we are creating this space for you to be able to keep tabs on that. But just stepping back from the flood of information of what we're seeing in that local government action tracker that we'll make available to everybody, it really does seem like the first wave of activity for a lot of local governments has been figuring out issues for themselves just as organizations that many of you in the nonprofit community are figuring out in real time in your own organizations, like what to do with your facilities, what to do with your employees in the time of social distancing and all that, and pivoting to conducting business in different ways. The good news for a lot of local governments is that many of them had emergency preparedness plans and all that they had developed previously that gives them a good framework and a good jumping off point about how to do that kind of stuff. So how do you conduct a city council meeting or a school board meeting or a county commission meeting and still make decisions that they need to make right now virtually and in other ways that are different from how they normally conduct their business, so that they don't have to figure all of this stuff out on the fly. I will say that a lot of the very early decisions and activities that local governments are doing after they activate and declare those emergency plans is just, like I said, figuring out what to do with their employees. A lot of local governments are major employers in communities across the state of Colorado. They employ a lot of people in Colorado. So how do they continue to do their business? How do they keep their employees safe and healthy through these times? And then figuring out what to do with all the facilities that they operate. So, and we have seen a number of closures on that front when it comes to things like recreation centers, libraries, city buildings, that kind of stuff. So just figuring out how to address those kinds of things too. And then translating what those closures mean to the types of services that local governments provide to Coloradans all the time. And what types of services need to be suspended or interrupted entirely, and which ones can continue in some kind of, albeit modified shape and form going forward. So for example, for school districts, we know that a lot of them are really focusing on how they get school meals that a lot of their students rely on ordinarily, and nutrition resources delivered to students and families in other shapes or forms when kids are no longer going to school and all that. So that's been a major wave of activity that we've seen across local governments in Colorado. Once they get over that hump of figuring out what to do with their facilities, with their employees, with which services can continue and in which shapes or forms, then we see local governments starting to turn their attention to some policy decisions as they're able to get over that first wave of activity. And a lot of the policy decisions we've started to see emerge from local governments focus on the kinds of things that they have within their local authority to give folks who are impacted by the changing economic conditions or by the shutdowns and interruptions to normal business and normal life across Colorado, to give folks some grace on things like fees and deadlines. We've seen a lot of talk about moratoriums on evictions and utility shutoffs and all that. So when you're able to get access to this local government tracker, you'll be able to see a lot of that stuff starting to show up across cities, across counties, and across school districts in Colorado about how they can help out the constituents and the Coloradans that they normally serve with the tools that they have in their toolbox.
That's a lot going on at the local level. And I have to say, it feels pretty impossible to even keep up with what the federal and state governments are doing. How is anyone supposed to keep up with what local governments are doing too?
Yeah, so we hope that this tracker of local government activity gives you one-stop shopping to be able to keep pace with that. As I said, we have a team of folks and contractors who are working on keeping that as up-to-date as possible. And so you'll see sort of city by city, county by county, or school district by school district, what we know and links to where those local institutions are posting their announcements as those become available. And just some ways that I think that tracker, or that we hope that tracker could be useful to nonprofit organizations on the call today, is that if you're an organization that works across communities in Colorado, this can help to give you a line of sight into what's happening on the ground in specific places across the state that you might be wondering about. And if you're an organization that's anchored in a specific local community in Colorado, it might still give you some new information about what your local institutions are doing. But also, if you scan through the list of what other places across the state are doing as well, you might get some creative ideas that you can share with your local leaders. If you spot something that you see a different city, a different county doing that might make sense for the situation that you see on the ground unfolding in your local community, this could be a great way to sort of crowdsource some ideas and to share that with your local officials as well. So we do hope that this tracker is useful to folks.
Thanks, Kyle. So a lot of response to some really tough news. And so that's, I know, what's getting me through this, the way people are responding. And I feel very grateful to work at the Colorado Health Foundation, where we've been responding. in some big ways. We are just about to turn to audience questions. I'm seeing the questions come in. A number of questions are circling around this idea of what are nonprofits to do in this moment. So I want to bring a special guest into this conversation. Erica Snow is one of our portfolio directors here at the Colorado Health Foundation. Erica, I'm seeing questions come in. I mean, financial resources are always strained, and now they're more strained than ever at nonprofits. I mean, what are nonprofits to do? Can you tell us a little bit about what support is available either from the Colorado Health Foundation or other sources?
Yes, thanks, Jace. I'm hoping you can all hear me.
We can, you're good.
Okay, great. Things are moving rapidly and changing rapidly in this space just as much as you heard in the policy space. The philanthropic community is working to get supports out to community. This includes the Colorado COVID-19 Relief Fund. Yesterday, some of you may have heard the governor unveiled the COVID-19 Relief Fund. Many foundations are contributing to this effort, and this includes the Colorado Health Foundation. These funds will supplement the governmental response to the virus and will help pay for things like medical supplies, cleaning supplies, food services, childcare for emergency workers, behavioral health supports, and a lot more in that. If you are an organization that is needing help with the response, you are likely going to be able to apply early next week. The website we will again be sending out these materials is helpcoloradonow.org. There's also information on this website on how to volunteer, to include virtual volunteering, as well as on providing blood donations. In addition, there's a lot happening statewide among the funding community to coordinate a statewide community response fund. So the Colorado Health Foundation is also working in partnership with a number of funders across the state to create a coordinated plan to support the nonprofit sector and addressing emergent needs. Right on top of the list is looking at getting supports out to the primary care safety net, food and housing safety nets. So we'll be sharing more on this as it develops. There's a number of local resources right now. A number of community foundations have stood up relief funds. These include the Aspen Community Foundation of Boulder County, El Pomar Foundation, Longmont Community Foundation, and Pikes Peak Community Foundation. Oh, as well as Colorado Springs Health Foundation just launched their relief fund today. And there's issue-specific resources. We know, for example, that food banks are especially hurting. Feeding Colorado Food Banks recommends referencing your local food bank's website to learn how to contribute, volunteer, and find food assistance help. Also, the statewide Colorado Blueprint and Hunger Program Office is also coordinating food insecurity response efforts, including working with funders to establish a fund that organizations will be able to tap into for emergent needs. They're currently seeking community input, and there's a survey out in the field, and we will be sending the link to this survey. So more information on that, and please, if you have time, provide input into that survey. And then finally, there are supports through the Colorado Nonprofit Association. They've compiled a set of resources to help nonprofits navigate the business operations in the midst of this crisis. So there's a number of resources on their website. So we'll be keeping our website up to date as well with these resources, and again, sending these all out to you after the session today.
And I see a number of folks are also putting resources in the chat box. I believe we'll gather everything up in the chat box to make sure that we're capturing everything that we send out to you after the fact. Erica, I wanted to see anything specific that the Colorado Health Foundation is doing that you wanted to touch on before we turn to audience questions.
Yes. So we announced earlier this week that we are providing full flexibility with our grant funds for all project and capacity building grants. These are for our current grantees. For grantees with capital grants, we ask that you contact your program officer and they can help navigate that. But right now, full flexibility. with using funds to respond to COVID-19 for all our project and capacity building grants. We are also suspending reporting requirements for all grants through June 30th. And there's no need, you can automatically have a no-cost extension on your current grants. So those are some of the things that we are doing in the near term. And again, working rapidly to get out other resources to current grantees and to nonprofits across the state in response to COVID-19.
Thanks, Erica, and thanks to Dawn and Kyle as well. Those are all the questions that I had, but I know we've got a lot of questions in the chat box. I want to remind you, we won't be able to answer everyone's questions today. We've got about 15 minutes, so we'll do our best to answer some of these. But remember, this is a first conversation, not a last conversation. So we will be together again in some format to continue sharing information. My colleague Gene has been watching all the questions come in. And he is going to try to make some very difficult decisions on what questions go to our panelists. Gene, are you with us, and can you pose the first question?
Yeah, thank you, Jace. So the first question is about some of the impacted populations, and Dawn, this one is for you. What of the federal policy changes apply to the undocumented population within the country?
Great question. So I'll weigh in, and then if my colleagues, I have 3 colleagues on the line as well, if they want to weigh in as well, I absolutely welcome that. So one, in terms of testing, it does not require, testing only requires a doctor's order and an ID. That ID does not have to be a government issued ID, so it could be anything. So that's intended to try to make testing accessible to the undocumented community without the need for like a driver's license, for example, which they may or may not have. That's one piece. We are seeing some additional funding, and Phyllis I was just answering some of Phyllis's questions in the chat about this. There is a large portion of funding, $1.32 billion, that's included in the draft third package. I just want to stress that it's a draft, right? It hasn't actually passed yet. There are other versions. So if there's something that isn't hitting the nail quite right, like by all means, please call our elected officials. And I know that, as Phyllis was just indicating, that wouldn't apply to all health centers in our state. But certainly that money is intended to help support the community health centers, who in turn make access available to the undocumented community. I don't know if Taylor, Elisa, or Josh want to weigh in on any other pieces that are specific to that. Oh, I'm sorry, I do want to add one piece before they do. In terms of nutrition, schools, at least my understanding is that schools, for example, as they share their nutritional resources, are not requiring any kind of identification whatsoever. And that is specifically so that it's available to the entirety of the community, including our undocumented communities. Of course, this was already an enormous time of fear for them with public charge and so many other things under this administration and ICE raids in California, despite amidst lockdowns, et cetera. I just want to recognize truly what a scary time it is. Those are the pieces I'm familiar with that's included in the packages so far.
Thanks. The next question is about any direct funding that you believe is coming from the feds to the community health centers and federally qualified health centers.
Okay, so that's in the either first or second package. I apologize, I'm not entirely clear at the moment. In one of the packages that has actually passed, it includes $100 million for CHCs. That, of course, if you were to divide it evenly across the nation, would only be $2 million for us, which is not very far. It would likely be less because we have a smaller population, right, compared to some other areas. The piece, what's included in the draft for the third package, is $1.32 billion for health centers. So again, like, by all means, advocate with that, call our senators, let them know, like, you either agree with the definition or you don't, you want it to be broadened in terms of how that could be used. It's as defined under section, for folks that work in this arena, 330 of the Public Health Service Act. And I mentioned that in the chat.
Thanks, Dawn. One question that came up quite a bit is around the new paid leave policy out of Congress. Do you know the mechanics of how that will be either reimbursed, or is it a credit?
I don't know. That's a great question, actually. I don't know. This is actually an area we haven't worked in really extensively before, because sadly there's been such a void of any paid leave in our country. There are slides that are included in the follow-up materials that you'll receive, not just the slides that were used today, but like our full deck of slides for this. And that includes a number of slides that are specific to FEMLA and paid leave. It's a great question about the mechanism. By the time I got to that piece, to be entirely honest, it was about 2 last night. And so it's not entirely clear in my mind. I'm happy to include that as part of our follow-up. What that mechanism is, it is described, but I don't know offhand. Elisa, Josh, or Taylor, by chance, are any of you more familiar with that section? Or just clearer in your mind at the moment than I am? I apologize, folks. Okay, while we do other questions, if they happen to be state or local, I'll pull up that part of the bill as well.
Sounds good. Kyle, this question is for you around what is happening at the state level. We still have a number of individuals who are uninsured. Is anything happening here within the state to attempt to get more people covered?
Yeah, so there are developments on a few different fronts there. One of the flexibilities that the National Emergency Declaration unlocks for federal centers for Medicaid and Medicare, which oversees the Medicaid and Medicare programs, is changing out or sort of opening up how Medicaid and CHIP eligibility determinations are made and all that. And so we've seen in Colorado, the Department of Healthcare Policy and Finance change some rules and change up some policies and procedures about how folks who aren't already enrolled in Medicaid and CHIP can get enrolled into those programs. So I encourage folks to go to the HCPF website for the latest and greatest on that. And I believe we have a link that we could share out to where they're posting that kind of information. And then one other thing that happened earlier this week, the Colorado Health Benefit or Health Insurance Exchange, Connect for Health Colorado, has opened a special enrollment period that's open through April 3rd for folks who want to purchase coverage through the exchange. They now have the ability to do that outside of the regular cycle of enrollment into health insurance that's made available through the exchange. And so you could go to connectforhealthcolorado.com and refer people there for the special enrollment period information that they just unlocked earlier this week.
Great, thank you. And something that Dawn mentioned as a federal policy change around telehealth, I believe is also happening here locally through HCPF as well. Can you speak to any telehealth reimbursement changes?
Yeah, so that's been another major front of activity in the healthcare space, is on the fly changing how different services can be delivered to folks so that we're less reliant on folks actually going in physically to see their providers, and a lot more services are able to be delivered via telehealth and then reimbursed to providers who are providing telehealth services, so that we're doing as much to socially distance patients, providers, and all that, and minimizing contact among people who otherwise wouldn't come into contact with one another. And so a few places that folks can go for the latest and greatest, whether you're a provider, a patient, or somebody interested in this topic and going deep into the details there, is again the HCPF website, where they're consolidating their COVID-19 updates and sort of rule changes and policy changes there, as well as the Division of Insurance, which regulates sort of private insurance plans across the state of Colorado. They're doing a lot of rulemaking and sort of unleashing additional flexibilities about how private insurance can pay for and deliver additional services via telehealth and telemedicine.
Thank you, Kyle. May I add one thing back to the previous question? For individuals interested in the paid sick leave pieces, thanks to my colleague Elisa, we just shared the summary of it from the Appropriations Committee. So it's in one of the most recent segments of the chat function at the moment. Also, for individuals who can't access that or don't have access to the full bill, I pasted the text for those of you that specialize in that arena.
Thanks, Dawn. The next question is around childcare. What is the state doing to address the needs for childcare, either from a workforce or public health standpoint?
Yeah, so that's another great question and another sort of flurry of activity happening on the childcare front. One of the resources and things that the state has stood up is essentially some emergency childcare resources that will stay open, particularly for children of frontline workers. So healthcare personnel, first responders, folks like that who need to continue to show up at work and but have kids at home that they need to make sure are cared for and all that. So the main landing page the state has stood up, which is covrn.com, has some information about that kind of emergency childcare services for first responders and frontline workers that are available to them. And then for some of the state agencies that sort of regulate the childcare space in ordinary times, like the Department of Human Services and all that, they've been doing a lot of like emergency rules, flexibility, support for daycare centers, childcare providers, folks who provide family, friend, and neighbor care for young folks and all that. So the Department of Human Services is a good place to go for the latest and greatest on the childcare front in Colorado as that situation is changing too.
I think we have time for one more question, but I will go ahead and just draw your attention back to the screen of all the things we're going to send you after the fact. There were so many questions about that. We will send you everything we have. We believe in radical sharing, so we will share out a lot, and then you can still ask for more. Gene, would you give us one last question?
You got it. A lot of questions coming in through the chat around how local governments can support the homeless population, and if you're aware of any examples.
Yeah, so I would say that this is one area to keep your eyes peeled on, that local government tracker that we've stood up and will be making available to folks. And I would sort of put that in the vein of, local governments are pivoting what they're doing with their facilities that had been used for a different purpose, like rec centers, high school gyms, those kinds of things. That is something that a number of local governments are thinking about, activating those kinds of spaces and resources to make available to folks experiencing homelessness, so that they have access to like hand washing facilities and can be socially distant from one another and have access to services and all that. That's been sort of something that local governments have largely gotten to after they get over that first wave of activity that I mentioned of declaring emergencies, figuring out how to conduct business and make decisions, and what to do with their regular business and all that. But that is something that I think is getting increasing attention from local governments across Colorado. So I encourage you to watch the space of the local government tracker for some ideas that might be happening in your own community, or ideas that other communities across Colorado are doing that you might want to share with community leaders and decision makers in your community if it seems like it might be a good thing for you to suggest that you try out or activate in your own local community.
Great, thank you, Kyle. And thanks to all of you. We're seeing a lot of resources coming through the chat box from folks who are attending and listening in today. So much brilliance across the state, and many of you took time out to be with us. So I want to say thank you again. I believe that the chat function is recorded, so we won't lose those resources. As you well know, we have promised to share out. So I want to say thank you for joining us. Thank you to Kyle, Don, Erica, Jean, to Danny, who's been behind the scenes doing everything that you haven't seen. So thank you. We will be back in touch with you with these resources and information shortly. And please have a good weekend at home. Take care.